What exactly would cause a woman to want to pop out that child, before time?
Okay. The things that can cause preterm delivery are many, and one of them is some things that have to do with the mother.
Okay.
The first one is chronic illnesses in the mother, and this chronic illness can be as a form of, as she mentioned before, hypertension, which we call preeclampsia in the mother, and also diabetes. In a mother with diabetes, it can be a gestational diabetes. That is diabetes that started with the pregnancy, or a chronic, that the one that has been ongoing before the pregnancy. That's a diabetic patient that got pregnant. Then diabetes can be a cause. Then apart from that, other chronic infection like renal diseases, cardiac diseases in the mother, maybe a mother that has a cardiac condition. All these chronic illnesses can lead to the pregnancy ending before time. Apart from chronic illnesses, there are infections in the mother, like uterine infection. That's an infection in the womb.
Okay.
Then there are also cervical infection. Any infection around, or even if severe systemic infection in the mother can lead the mother to bring out the babies before time. Apart from that, there are structural abnormalities. Maybe the womb is not structurally abnormal. It's not well positioned. It's not well formed like a normal womb of a woman. It can make that woman not to extend to 9 months, expanding to carry this baby. Then, apart from the uterus, which is a womb, you have the cervix. Cervix is the window to the womb, is the door. Let me call it the door, not the window.
Okay.
Where you talk about when it's dilating, that's when the baby comes out, where the baby comes out. So, if the cervix is short, or other abnormalities of the cervix, it can lead to preterm delivery. Then, when you have multiple gestation, like 1 and 2, 3, 4. Sometimes in these days of IVF, you have 4 babies in the womb. The space may be too small for them all grow to maturity. So by the time they grow to a certain age where the womb cannot expand again to contain them, the tendency is that the mothers may go into preterm delivery. These and many more can lead to.
Recently, we had a young girl who was 22 who got pregnant out of wedlock, got pregnant for her boyfriend. She's just 22 in school, and she was threatening to abort. Okay, and she kept crying, I can't, I'm in school, I'm in third year, I can't do this and all of that. So she calls into one of our shows, and then we talk to her, try to get her to say, oh no, you can't abort the baby, we are pro-life. And then she agrees to keep the baby, right? And then I think it was about 3 weeks later, she calls again, and then all hell was let loose. She was screaming, says, no, I've just gone to hospital, and it's not just one, it's two. I'm not doing this, right? And then we go through another rounds of trying to tell her, no, you can't abort. Please just keep the babies, right? Anyway, some time passes, the parents get involved and all of that. They decide they're going to marry the two young, the 22 and the 24-year-old. Then I think 2 or 3 months later, she calls and then she's flabbergasted. No, it's not 2, it's 4. They just found out it's 4. It's 4, and we thought she was joking, and she kept, crying. Anyway, she just recently delivered, and babies are fine. It was just like a seamless, So my question is, did she give birth to those babies hale, hearty, everything fine because she's younger? Or did her age help to make sure that she carried those babies, because there were no complaints, there were no issues, there were no stories. I think it was 3 girls and a boy. Okay. And did her age, being 22, still being young, did it affect the viability of the children? Did it affect the process of her giving birth to the children without any complications? Did it have anything to do with it?
Yes, thank you for the question. The truth is that age, at the time any lady has her first child, plays a very important role. So that age of 22 is a good time. It's not less than 18, and it's not more than 35 years. So at that time, the risks of other medical disorders that accompany
aging
is minimal. All right. Now, some of the, I don't know what happened. It's obvious it was a natural conception.
Obviously. She got pregnant for her boyfriend in school.
So you see, okay, we also notice that maybe the medical care, the nutrition, and her pre-pregnancy state now.
Okay.
What do I mean? Like, if she was not diabetic, not hypertensive, which is most likely to be the norm among that age. So you see that her pre-pregnancy state would have helped. Also her weight, probably not obese, not
Does weight affect?
They all contribute in different ways. So we are not looking at just the age. Yes, age is very, very key, but I also think there are other prevailing factors that might have helped her to cope
with that. Okay. 0706-048-5853. You can either call in to ask questions, or you can send a text or a WhatsApp message to ask your questions. So Doc, I'd just like to ask you, what causes a woman who was perfectly fine to suddenly develop high blood pressure during pregnancy? Is it just the pregnancy decided to trigger some things in the body? Because I've seen ladies who never had an issue, was perfectly fine, has never had a blood pressure issue until they got married. As a matter of fact, I had a woman who unfortunately didn't survive. She didn't survive, her baby didn't survive. She was at 39 weeks of pregnancy, got to the hospital, was about the time to give birth. I think her blood pressure was high. The doctors were supposed to try to bring it down before they carried out the procedure, on her. And somehow something went wrong in that hole and she didn't make it, the baby didn't make it. What exactly causes high blood pressure during pregnancy, especially when the person did not have it before that pregnancy?
Okay, thank you. Pregnancy-induced hypertension, that's what we call it.
Okay.
Or preeclampsia is common, and it can occur in people not pre-pregnancy time without hypertension, and most of them has to deal with the placenta. The placenta secretes some hormones, and these hormones are supposed to keep the baby alive and keep the baby, maintain the pregnancy till term. And these hormones in some people are adversely affect some people, leading to their blood pressure to go high. It doesn't happen to everybody, and it has nothing to do with age, although it's more common in elderly people than in younger people. But it can also occur in perfectly young woman that's just got pregnant without hypertension beforehand. It has to do with the placenta hormonal secretions.
So it's obvious that between 17 and 35, that's like a safe time for you to give birth to all of your children without all the many issues. And then after 35, you are in God's hands.
It's high risk.
It's a high risk.
So 35 is a high risk pregnancy.
And below 17 is also a high risk pregnancy.
Why is that below 17? Body hasn't developed?
Yes. There are tendency for the girl is not developed to carry pregnancy. No, the birth canal is also not developed to birth the baby.
At 17?
Yes, that's why it's also a risk factor.
Okay, let's talk about steps to prevent this preterm. Are there some things that we can do, right, Doc, to prevent? Is it preventable, having a preterm baby? I mean, everyone who gets pregnant really wants to carry their babies to full term. But before I ask that question, I think I'm a culprit, right? I think I'm a very lazy mother, me. So for me, when I get to like 36 weeks, I'm tired. I am worn out. I want the babies out, So I had, I think it was my second baby. I got to 36 weeks and 5 days. And my doctor, Professor Chibu, he was going to travel abroad, and he was going to come back at 39 weeks. And I just could not imagine me carrying the babies to 39. So I opted to bring out the baby at 36 weeks, 5 days. Did I give birth to premature?
Yes.
Yes.
You did.
But he came out at 3 kg, 3.2 kg. He came out really big. he came out really big. So at that point, was he a preterm baby?
Yeah.
Yes.
Any baby that has not completed 37 weeks is term preterm. So you delivered late preterm. And that is not supposed to be so.
1 minute to
It's not supposed to be so.
2 minutes.
The truth is that the longer they stay in there, the better for them. So as long as the mother is fine and the baby is fine, there is no massive rush bringing out that baby. Oh yes, I had the same experience, but my own, I was denied. They said my baby must remain there. I didn't pass 40 weeks.
Are you serious?
They said no way. That is not yet the time to indulge the baby. That I'm fine and the baby is fine. That if I should do that, it means that I'm not helping the baby. Because the truth is that late preterm baby still needs to struggle to cope with the environment. Honestly, that is the fact. It's just that they are likely to do better than the ones
The
that,
early preterm babies.
Okay. So back to our main question, prevention. The truth is that for us to look at the prevention, we also have to understand that the same way we have multiple factors contributing to preterm delivery. That is also the approach we look at prevention. Now, she talked about the causes. Also, there are factors that are modifiable and there are factors that are non-modifiable.
Okay.
For instance, one of the causes of this preterm could be familiar, because you've had it before or because there is a family history. You stand a higher chance of giving birth.
Genetics?
Yes.
Okay.
They also have some genetic factors, like in terms of cervical insufficiency. She talked about cervix. To some people, their own cause of preterm is because their cervix are short and insufficient.
What do you mean by insufficient?
They can't really hold on and carry the baby till term. Some of them, they do circulate for them.
Yeah, so doctors, you like to speak very big grammars, right? So we are talking to the woman on the street, right? So you're saying, the cervix is short and it doesn't have the manpower to hold on to that baby.
Yeah.
Okay, so circulage means you go back to the hospital and they tie it
something.
Okay, to hold it to the baby from coming out.
The pressure and the force. That's one of the reasons why multiple gestation, they are also a factor, because with the pressure, the weight, it can actually start opening prior to the term.
I see.
Okay, now, so when we talk about prevention, we have to consider the factors. The ones that are modifiable, like lifestyle. Okay.
Yes. Talk about lifestyle. What exactly is lifestyle? Drinking?
All right, I'll come.
Tell me.
All right. So let's do the prevention.
Thanks. Please continue, doctor.
All right. So when we talk about prevention, we have to take it from multiple dimensions. Now, it starts even before a woman gets pregnant.
Okay.
Now we call it pregnancy prevention.
Okay.
For instance, if a woman has been a known diabetic, hypertensive, any other chronic medical condition, it would be nice to make sure that you are taking good care of yourself.
What kind of care?
Like sugar control, blood pressure control, sticking to your specialist advices and appointment, knowing that those medical conditions could be exaggerated during pregnancy with all the hormonal secretions and stress and all of that. So you have to be sure that you're already in a very good clinical condition as much as you can.
Okay.
Again, it's also advisable that you take care of your nutrition, healthy, balanced diet, optimize your weight.
Healthy, balanced diet in this economy.
Reduce your weight.
How do you
if you're already obese? Remember, the pre-pregnancy weight has effects in the course of the pregnancy.
Weight?
Yeah. Whether it's under or it's over, it's a problem. Again, if there is a family history, it's also the time to go to hospital for maybe genetic counseling, and you be assessed and you know the risks and all of that. These are the things to do. Then if a lifestyle, smoking, alcohol intake, substance abuse or those illicit drugs, is also to adjust the lifestyle one is indulging in. Then again, stress. Start limiting stress. Now, when you are now pregnant, it's good you go and register in a good hospital. That brings to quality health care. Why will you go? The reason is that, especially if you have a family history or if you had once delivered a baby before time, you will be evaluated and assessed and classify you accordingly and find out probably the causes of those previous preterm. For instance, if it's someone that has cervical insufficiency, it will be monitored and know whether it requires attending to circulage or bed rest. Then if it's due to progesterone hormonal imbalance, some will be given supplemental progesterone. Then the pregnancy will be monitored. We all know that anything can go wrong at any time. Screen for infections, like she said, infection at the cervix, urinary tract infection, systemic infection, they can predispose to preterm delivery. So these are the benefits of registering early. You'll be monitored, you'll be assessed, the baby's growth will also be assessed and valued. Then depending on the identifiable cause, you will now be guided appropriately. Now, you have support is also very important. Yeah, it's part of the prevention.
We'll just hang on a second so we could take this call. Yeah, hello.
Your call has been placed on hold.
Okay,
Please
so
wait.
okay, that was a mistake there. Okay, do call back. Okay, we'll have quite a lot of persons trying to call in now. Just do keep trying to call 0706 048 5853. And if you're trying to call and it's not connecting, just do keep trying again. 0915 570 8347. That is our number this morning. Please continue, doctor.
So we talk about support from everybody around.
Okay.
You may need to rest. You may be excused from carrying heavy objects. Some people, by just process of lifting heavy objects, it will be a trigger. So you need family support, extended family support, to understand when you are asked to have a bed rest, you should have a bed rest. So with identifying your risk early, modifying the things that ought to be modified, presenting early to the hospital, go for antenatal clinic. Some women don't go early. They go when the doctor is about to finish so that they won't waste time. So most of those educational talk, they don't get it. How to take care of themselves, how to rest, what we call red flags, when to know that you're having this, this may be what is about to happen, when to run to the hospital. So you have to be going and make sure you're monitored, you're evaluated, both you and your baby. Then at doctor's discretion, depending on the cause, because it may not happen immediately. Some can actually come and with bed rest and some tocolytics, the drugs they give to quieten the contractions, you may just be admitted. After a few days of hospitalization, you go home. Then again, there are also drugs that can be given. Perhaps it's progressed to help the maturity of the baby, lung, and that will improve their survival. So in all, it's about individual support, hospital support, community support. So if we get all these things right, we can prevent some, while some, in some cases, even having done everything that you need to have done, it will still expel. Most time maybe that the baby had congenital or chromosomal abnormalities, because these are different causes of preterm delivery. So maybe it has condition that is not really compatible with life. So most of them, at the end of the day,
the body just wants to expel it.
Congenital anomalies and all of them, they come out alive and just spend few minutes or few seconds and die.
And die, okay.
So at times you can't really hurt them.
Oh, okay.
Please like, share and subscribe to our channel for more in-depth analysis on current events and their impact. Leave your thoughts in the comments below. We'd love to hear from you.